Hello, my name's Tracy Whitty and I run b12deficiency.info. This petition asks the Department of Health to add testing for B12 deficiency to a full blood count. At present, some patients, including children, are refused testing for B12 deficiency despite having many symptoms. This is due to a lack of knowledge of this very common serious neurological condition. Many of the symptoms are non-specific, tiredness and depression for example, but NICE guidelines bizarrely instruct doctors not to test some at-risk groups unless they're anemic. These are patients diagnosed with chronic fatigue and ME. B12 deficiency causes suffering and serious injury, even death, but it remains undetected in thousands, if not millions of people. B12 is a complex vitamin, and when patients cannot absorb B12 from food, treatment must be given by injection. It affects all body systems, all ages and both sexes, and it can be misdiagnosed as conditions such as Alzheimer's, bipolar, mini-strokes, vertigo and fibromyalgia. There are many symptoms including numbness and tingling, memory loss, impotence, tremor, chronic fatigue, psychosis, incontinence and frequent falls. It can make men and women infertile and cause developmental disabilities and autistic-like symptoms in children. Some common medications, including metformin for diabetes and acid suppressants, can cause a deficiency in B12. It can also be caused by genetic defects, some surgeries, bacterial infections such as H. pylori, and parasites, to name a few, and yet there's still no routine testing carried out in at-risk groups. This can and does lead to misdiagnosis. Of course, not every illness is due to B12 deficiency, but as already stated, it is very common and it's crucial that it's ruled out. Can you imagine being sectioned simply because your doctor did not recognise your B12 deficiency symptoms? Can you imagine your child being permanently damaged because of a misconception that B12 deficiency only affects women over 60? Dr. Carr, a paediatrician, was misdiagnosed with a rare, incurable neurodegenerative disease. He was deaf, demented, and wearing a nappy. He was close to death before being correctly diagnosed with vitamin B12 deficiency. You can see Dr. Carr featured in the documentary film below. The cost of adding these tests to a full blood count is a tiny drop in the ocean compared with the cost of misdiagnosis and delayed diagnosis, which can lead to permanent neurological damage and disablement, resulting in astronomical costs to both the NHS and to society. B12 deficiency is simple and inexpensive to treat, and you can help to make a difference by signing and sharing this petition. For further information, please see the text below. Thank you.